Greetings, Thyroid Foundation of Canada board members and stakeholders. My name is Paul Stewardson. I am a PhD candidate in the laboratory of Dr. Ralph Paschke at the University of Calgary, where I have been working since 2017. I'm joining you today to provide a progress update since being honored with the Thyroid Foundation of Canada 2021 Research Award last October. For those who have not yet heard about our research, allow me to provide some context. Dr. Paschke's tireless clinical and research work has made Calgary a unique setting in which to conduct research and improve thyroid nodule diagnosis and thyroid cancer treatment. Over the last several years, the groundwork for this project has been laid through the introduction of guidelines-based ultrasound malignancy risk assessments, determination of the local risk of malignancy in each cytology category, creation and implementation of Thyrospec, Canada's first ever thyroid cancer molecular diagnostic test, design and implementation of a local referral pathway, and the creation of a tumor board that discusses every single thyroid cancer case in Calgary. All of these crucial planks came together in July 2020. COVID slowed us down, but we did not let it stop our work. The integrated pathway became ready to be evaluated systematically at that time. With your support, a systematic evaluation is exactly what we are now in process of accomplishing. Through this project, we have created a comprehensive database of consecutive indeterminate thyroid nodules with all pertinent clinical data, including genetic alterations, providing a rich data set from which to calculate the incremental accuracy of each individual diagnostic intervention in the pathway, with sufficient granularity to identify any remaining clinical gaps which are being addressed as we go in real time as this project progresses. Now, based on our first interim analysis in this ongoing study, since July 2020, when Thyrospec was implemented in Calgary for all indeterminate thyroid nodules, surgeries have declined a statistically significant 24%, and the prevalence of cancer in the nodules that have been surgically removed increased a statistically significant 46%. This means with fewer invasive surgeries, we are removing more malignant tumors, thanks to our improved pre-surgical diagnosis. Moreover, molecular testing expedites time between diagnosis and surgery by an average of 100 days for patients with high-risk mutations compared to patients without mutations. Not only that, but unlike most similar studies that rely on questionable assumptions regarding the clinical impact of molecular diagnostics, we have shown directly, based on actual clinical records, that in 70% of thyroid nodules with mutations detected by Thyrospec that subsequently underwent surgery, the primary reason for surgery was the mutation detected by Thyrospec. Therefore, Thyrospec is having a direct impact on clinical decision-making that is already benefiting patients in Alberta in the context of our optimized local diagnostic pathway. Now, these three data points are just some of the critical findings with a measurable, meaningful impact for patients that we have demonstrated thus far. Having said that, we still have several important research questions that require more data to be able to answer and will be calculated in future analyses as the sample size increases over time. We are keenly aware how important it is for our integrated diagnostic model to not stop here, but be used as a template in other centers. And we want to stress that although it takes work to implement, every single component of our diagnostic pathway can be replicated in other centers all across Canada, and we are working with colleagues to ensure our research is disseminated fully. In fact, just last week, a surgeon reached out to ask about our data and diagnostic tools as he works to improve the thyroid nodule diagnostic pathway in his province. And we made ourselves immediately available, offering our molecular diagnostic test, Thyrospec, which is already available Canada-wide, and our interim data analysis from this project on all the other pathway components and corresponding outcomes. In fact, the same outcomes that you see in this poster behind me that is from a recent research symposium presentation. We will present an updated analysis based on accruing data of our results at the Canadian Society of Endocrinology and Metabolism annual conference in November. And we stand ready to provide every tool needed to any center interested in optimizing their diagnostic pathway, along with data proving its real-world effectiveness. Now, I am thrilled to see the efforts of so many brilliant scientists and clinicians such as Dr. Marcus Eslinger and Dr. Musa Khalil come to fruition in this comprehensive analysis of the state of the local diagnostic pathway that has and continues to illuminate the progress made to date and opportunities for further optimization. We want to thank the Thyroid Foundation of Canada. Because of your support, we are able to show exactly the impact of our work over the last several years, which will facilitate knowledge transfer to more centers across Canada, so that we will accomplish our shared mission to bring the best medical care to thyroid patients. Thank you.